and welcome back to another insightful episode of Medynapse podcast series. I'm your host, Hetvi Shah, and today we're diving into a critical area of oncology, which is head and neck cancers, a group of malignancies that not only affect vital functions like speech and swallowing, but also have a profound impact on a patient's quality of life and identity. And to help us unpack the latest in diagnosis, surgical innovations, and care strategies, I'm thrilled to have with me Dr. Manish Sadhwani, a highly respected consultant cancer surgeon and co founder of Ahmedabad Health in Ahmedabad. With an MCH in surgical oncology and years of hands on experience in managing solid tumors, Dr. Manish brings deep clinical insights and a patient centered approach to cancer care. So, welcome to the show, Doctor, and it is a pleasure to have you with us.
Thank you so much for having me.
Now, Doctor, let's start with the bigger picture. From your clinical experience, how have the diagnostic and surgical approaches to head and neck cancers evolved over the last decade?
Head neck oncology, both surgical and diagnostic aspects, I would say, have evolved tremendously. Like from crude era of resection to the precise patient-focused care, usage of imaging like PET-CT, MR, contrast-enhanced MRI, and then we have PET-MR fusion also to look for the proper staging and planning of the surgery. We have 3D planning now for the reconstruction. Prior, we go on 3D planning, recon, and then embark upon surgery. Even before starting a surgery, we have a virtual surgery itself. From the era of crude resection, we have evolved to a precise resection centric over the functional outcome of the patient over this decade. We have now integrated HPV testing in oropharyngeal malignancies. Multidisciplinary tumor boards are a routine in many centers right nowadays. A decade back, it was like a single doctor's approach and a single doctor's whims and fancies about management. Now it is a multidisciplinary tumor board deciding about management prior to starting any treatment. Surgically, the emphasis has shifted from not just removing the tumor, but to achieve oncological clearance with preservation of functional and aesthetics of the patient. Now, for example, I would say last year we did a surgery for a 43-year-old businessman with a buccal mucosa malignancies. Now, a decade ago, he would have ended up with a disfiguring face and speech issues. Today, with microvascular reconstruction and meticulous planning, he was back to work in a month, speaking, eating, and smiling with confidence. So that's the evolution I am proud to be part of.
Yeah, that's a great evolution, I think. And over the last decade, it's been really interesting. And that's a great overview as well. So now moving on, we are increasingly seeing a shift towards organ preserving strategies in oncology. So could you shed light on the latest trends in minimally invasive techniques, especially robotic assisted surgeries in head and neck cancers?
Absolutely. The shift towards organ preservation is both technological and philosophical also. Like TORS, transoral robotic surgery, is the front runner. It allows access to difficult sites like base of tongue and tonsils without disfiguring incisions. Earlier, we used to make a mandibulotomy incision or some of the times we had to do mandibulectomy also to approach such sites. But now with the advantage of the TORS, there is no disfiguring incision and we are directly in excess of base of tongue or oropharynx. Even in centers where robotics is not available, transoral laser or endoscopic resections have emerged as a reliable option. Now, in Gujarat, let's say last 6 months ago, I had a young school teacher with early stage supraglottic cancer. Usually, we go for a traditional open partial laryngectomy. But in this particular case, we performed a minimal access transoral laser resection. She retained her natural voice, was back in her classroom under 2 months. And these are the victories we talk about when we talk about minimally invasive surgeries with proper functional outcome. robotics for base of resection, oropharyngeal malignancies, likewise endoscopic surgeries are being embarked upon for neck dissection also. Thyroid malignancies are also being done with the technique of robotic as well and as endoscopic. So these are the approaches which are being taken up in every center nowadays routinely.
Yeah, I think it's very incredible, and I think these robotic and minimally invasive techniques have been truly a game changer. So now, speaking of advancements only, doctor, are there any noteworthy clinical trials in the last year or so that have actually influenced treatment practices in head and neck cancer management?
For last couple of years, if I talk about one of the trial which comes to my mind is Keynote 048 trial. It truly changed our approach about recurrent metastatic head neck malignancies. With addition of pembrolizumab, we now offer better survival with fewer side effects, particularly for PDL1 positive tumors. So this was about the metastatic or recurrent lesions where we are now routinely giving pembrolizumab. Second trial which I think about would be de-escalation trial, Pathos and ECOG 3311, where HPV positive oropharyngeal malignancies, these patients do very well, and so we have started de-escalating the treatment. So we are avoiding over treatment in HPV positive oropharyngeal malignancies. In our center also, we have started beginning to adopt more personalized protocols based on these trials, balancing cure with quality of life.
Yeah, I think that's really insightful, doctor. And I think clinical evidence is such a powerful driver for change, definitely. Now, let's just touch upon what happens after surgery because that is so important for head and neck cancers, also preserving the organs. So, like in cancers like laryngeal, tongue, or oropharyngeal cancers, post-treatment quality of life is such a huge concern. So, how are rehabilitation strategies evolving today?
So rehabilitation now has become an important part of resection itself. Earlier, we used to think about surgery and post-surgery adjuvant treatment, but now, before embarking upon surgery, we need to think about post-surgery and post-treatment rehabilitation of the patient. In head neck malignancy, ability to speak, swallow, and socialization defines our success for the patient. So. Let's give an example. We had a 60-year-old male, a singer by profession, with a head neck tongue malignancy. So post tongue malignancy, he was devastated when he came to know that we would require to do an hemiglossectomy in this patient. But with a radial forearm free flap, there was early speech therapy and a motivative rehabilitation team for the patient. He was back to singing, not the same as a singer, but he was back to singing, and we have his video recorded for a community event post 6 months after his treatment. So this video gives us a goosebump when we see a patient post tongue surgery is singing. So basically, this rehabilitation is very important. Likewise, when we talk about laryngeal malignancies, MLS technique in early lesions add to our rehabilitation because patient is in his natural voice. Secondly, for total laryngectomy, earlier we used to give electrolarynx, external device like a torch for a speech. It had a robotic tone to the speech and was not suitable. Now with the advances, rehabilitation of shifted from the electrolarynx to voice prosthesis. In voice prosthesis, internally we make a hole between a esophagus and a trachea, and this shunt mechanism uses and gives a voice. So this voice prosthesis has definitely changed the rehabilitation post laryngectomy. Nowadays, almost every total laryngectomy patient is rehabilitated by voice prosthesis.
Correct. That's actually so interesting to know that it's not just about survival anymore. It's more about, living well after the surgery as well and the treatment. Dr. Now let's just shift gaze to early detection. So, what role can general practitioners and dentists play in early referrals, especially in oral cavity cancers?
Actually, they play the pivotal role, I would say.
Yeah,
Uh,
true.
for early detection, earlier treatment, and minimal de-escalation of the treatment, we need to have an army of general practitioners and dentists who can detect early, refer early. So in Gujarat, where smokeless tobacco use is high, early
Mm-hmm.
detection is our best weapon, because
Correct.
second is the education and awareness part about cessation of tobacco and everything. But where the habit is there, the early detection is only our best weapon. I recall a
Absolutely.
dentist who has sent me a patient from a far away Kheda district, referred a patient with a non-healing ulcer from 2 weeks only. It turned out to be a squamous cell malignancy with T1 and 0. So was operated early, minimal reconstruction needed, no adjuvant treatment needed, and had an excellent survival odds. So that one referral saved him years of hardship.
Yeah.
Similarly, we need more such vigilant general practitioners and dentists. They are our frontline soldiers, I would say, in the fight against oral malignancy. Lower threshold for malignancy, in particularly for patients with history of tobacco chewing and having ulcer in oral cavity, is needed. And when I talk about dentists, not only they play a pivotal role in during referrals, but even after surgery, pre-radiotherapy, we have to have a good dental workup of each patient, treat their dental caries before embarking upon adjuvant radiotherapy. So I would say this, general practitioners and dentists have to be constantly connected with our oral malignancy patients before surgery, during surgery, and post surgery also.
Yeah, I think that's such an important point to consider, and they actually play a pivotal role. You rightly mentioned that. And finally, now, Doctor, for our listeners across diverse and resource constrained settings, what practical insights or messages would you like to share with clinicians involved in cancer care?
So I would say that you don't need high-end equipments to make a big difference. You would need a clinical curiosity and commitment towards the thing you are doing. Learning surgery is one thing, and with years of practice, you will be a good surgeon. But it is equally important and equally matters to each patient that we show compassion, we show the commitment towards patient's rehabilitation also. When we are removing a part of a body, we need to understand its functional outcome, and we need to rehabilitate the patient for that function itself. We need to learn the balance between maximum oncologic outcome and then the minimum post-surgical functional loss. So with the fear that I will lose this function, I cannot undertreat the patient and do minimal resection. I have to do a optimal resection to get the oncologic outcome also, and then I have to balance the functional loss also. So this is the trick which we need to understand. I worked in a regional cancer center, GCRI in Ahmedabad, before starting my private practice or a private center in Ahmedabad. I've seen that a simple torch, a tongue depressor, and diligently looking after an oral examination can also detect your early cancers rather than any scan. So we have to build strong referral network. Never hesitate to ask for help. I right now also ask my seniors if any tricky case is there. Remember that cancer care is not about surgery or chemotherapy. It's about listening, educating, and standing by the patient and its family. So
Yeah.
every timely referral, every reassuring word, we all are the part of healing process of that patient and his family.
Correct. That's such a powerful message to end on, actually. And Dr. Manish, thank you so much for joining us today and sharing your insights on this critical topic with us. So, thank you so much. It has
Thank you
really
very much.
been
Thank you,
valuable.
MedSynapse, to coordinate this and do a wonderful podcast on this topic. Thank you.
Thank you so much. And to our listener, thank you for tuning into this episode. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay curious and stay compassionate.